Welcome to the program, Minister.
Thanks, Sharri.
Now, the Ruby Princess cruise ship was allowed to dock and 2,700 passengers allowed by New South Wales Health to disembark and return to their homes across Australia. Nationally, there have now been more than 600 people tested positive for coronavirus and at least 10 passengers have died. This is now the subject of a criminal police investigation with coronial oversight. How do you as Health Minister explain this incompetence to the Australian people?
Well, first of all, I don't know that you could say it's incompetence. It's a difficult time at the moment because obviously coronavirus or COVID-19 is actually something which is causing massive grief. It's unprecedented right across the world. The question in my mind as the Health Minister is, obviously I would have preferred it not happen. We all would have preferred it not to have happened. But these cruise ships, sadly, have become crucibles of disease, of this particular disease. In previous times it's been gastro, obviously influenza, Legionella, but this time it's a bit different. What I do know, though, is as Health Minister, I asked when I was told, which was I think the next day or perhaps the day after, I think it was the next day after 3 people had been confirmed as positive, I asked what the strategies were, what the policies were, and what had been done. And I have to say I was satisfied that the very, very senior communicable disease experts, epidemiologists and public health physicians who made the decision to allow the ship to come in had actually done their job. Now, if they did, it's not a case of casting blame. It's a case of, as the Commissioner of Police said this afternoon, looking to see what information they were given. What information were they given from the ship and from obviously Carnival? And that's now very much in the purview of the police.
In terms of what information they were given, we know that Carnival Cruises told New South Wales health officials on the 18th of March in an email that 13 passengers had respiratory or flu-like symptoms and had tested negative to influenza. But New South Wales Health didn't wait for the test results before they allowed the passengers to disembark. Why?
Because I think there was a lot of pressure anyway, because the federal government had told the cruise ship companies to get their cruise ships in. Sydney Harbour was chock-a-block with cruise ships. But the essence was there was a federal protocol that came in on the 6th of March, which actually allowed, in fact permitted, very much so, health to allow a ship to exit the harbour, notwithstanding that there were tests being done. Now, these tests, I've heard that some people say there were tests for COVID-19 on board the ship. No, there weren't. Not possible. There were tests for influenza-like illnesses. And I'm not sure how many, but I understand it could have been more than 40. That'll obviously be part of the police investigation. When the ship actually docked, I understand it was either 13 or 15, I'm just not precise on that number, of the swabs that had been taken at sea for influenza were handed over to New South Wales health officials in accordance with the protocol, and the protocol required that that be tested, but it also laid out very clearly, and I remember this because I double-checked it as Minister for Health, on page 5 it stated clearly of the federal government protocol that pratique could be granted. In other words, the ship could sail.
But putting aside the federal government protocol, ultimately it was a decision of New South Wales Health to not wait for those test results, the test results of 13 people. I mean, you say now that there might have been 40 or 50 with flu-like symptoms, but there were 13 swabs were sent for testing. You know, federal protocols aside.
Well, actually, I didn't say.
Federal protocols aside, ultimately it was a decision of New South Wales Health to allow the passengers to disembark without waiting for those coronavirus test results to come back. Surely this is incompetence and not good enough.
First, Sharri, can I say that what you just said was a misinterpretation of what I meant. There was actually, I think, more than 100 people reported on board the ship as having influenza-like illnesses. But my understanding is, and this will be part of the police investigation, that there were more than 40 swabs taken on the ship for the influenza, but only 13 or 15, one or the other, were available when the ship arrived. What happened to the others, I don't know. Now, those swabs were done absolutely in accordance with the protocols. And I have to say, these are the very same doctors, physicians, public health doctors, who have been testing and checking thousands upon thousands of ships coming into our harbour for between 10 and 30 years. In other words, the particular 4 physicians who are involved from the public health unit have been doing this work for a long, long while. And I understand that at least one of them is a consultant in communicable diseases to the World Health Organisation. So as Health Minister, I could not have asked for any higher qualifications for the professional medical people making the decision. And I think the community should be satisfied that we had the best of the best making the decision. But so to draw conclusions,
I'm not drawing conclusions, but it is a crucial point. Why did New South Wales Health allow the passengers to get off the ship without waiting for those test results? I mean, that is a crucial point, and that is a question that needs to be asked.
Sharri, I'm sure when you go to your physician, as we all do, we take their advice. And I am the Health Minister, I'm not a physician, and I'm quite prepared to say the advice that was given to me is actually that they actually made the decision on the basis of what they considered was appropriate. And you know what? If you've got the best of the best making the decisions, it's a bit hard for us all to be challenging that decision.
But do you admit now that that advice and that decision was wrong?
No, look, that's not a position for me or for you or for anybody else to accept physicians of equal calibre to be able to make that decision. And I think it's important that at a time when we are all in effect the firing line of what is an unprecedented attack by a virus that is quite potent, that we actually shore up and give confidence to our doctors that we believe in what they're doing, whether it's in the surgeries, whether it's in the ICUs, whether it's in the theatres or whether it's in the public health unit. And until someone shows me that that is contrary, then I will back those doctors.
Minister, with all respect, given that now a third of the deaths in Australia were passengers from the Ruby Princess, how is it not appropriate to question why your health department allowed passengers to get off that ship before their coronavirus tests had come back? How is it inappropriate to question whether we didn't wait to find... But this is the question. Why didn't we wait to find out whether there was a coronavirus outbreak on board before allowing 2,700 passengers to go to their homes across Australia?
Well, you just said whether it's appropriate to question. It is appropriate to question, and I have questioned them as the Minister. And what I'm saying is I have not seen any evidence that indicates that those physicians, those experts that are absolutely brilliant in their field, have made a decision that others in the same situation with the same qualifications wouldn't have made. So I accept that. I also think that it's wise for us to reflect on the fact that this virus is so potent. We don't know how many people came on board from Sydney with it. They left Sydney on the 8th of March. And so you'd have to assume there had to be at least one, and I suspect probably many more, who came on, they had asymptomatic. In other words, they didn't have the virus, came on board that ship, they had it when they came on, they spread it, and when they came off, if that ship had actually stayed alongside the docks, as we had with Diamond Princess, and one would remember that was a disaster, then you would have had a much greater spread of the virus. So I think none of this is as easy, Sharri, as what you're suggesting.
I'm not suggesting, I'm really not suggesting it's easy.
I suggest that what you need to do is to actually look at the entire case, and I have to do that, and I'm doing it on behalf of the community, and I can tell you many sleepless hours looking at all these facts. So at this stage, it's now in the hands of the police, and I'm very pleased about that because that means that we can look to see what was the information given to these experts in the field that have done literally thousands of these cases in the last 10 to 30 years. What was the information they had, and how did they deal with that information? Beyond that, I don't think it's appropriate for me to comment on those matters.
The Police Commissioner, Mick Fuller, when he announced this criminal investigation today, he did make the point that when passengers had symptoms of coronavirus, so flu-like symptoms, that they should have been considered to potentially have coronavirus. This was at, the height of the outbreak that the ship returned on March 19, but they were not. Do you accept at least that...
Well, I don't agree with that. I don't think that's what the Commissioner said at all, and I watched the same interview. Perhaps that's your conclusion, but it's not my conclusion. What he was saying was that they had influenza-like symptoms, and obviously that is something which they will now look at in the context of how many people really had it on board that Carnival line, what information was given to the medical and health experts, the specialist doctors who would sometimes be saving our lives in other circumstances, what information was given to them. And I think that's appropriate. But there'll be a host of other things. I thought the announcement earlier today, this afternoon, by the Commissioner, was both insightful but also concerning, because obviously there are matters that have concerned the police so much now that they are referring it to a Deputy Commissioner and the coroner, and I think that's where it should be.
New South Wales Labor has called for your resignation over this scandal. Will you step down?
Well, the Health Services Union, which is a major labour union, has actually this afternoon or this morning met and issued a letter publicly confirming that that is absolutely not what should happen. And I think, you know, it's the highest I could put it is it's very unfortunate that the Labor leader in New South Wales and her shadow minister, who have been absolutely involved, I have consulted them on many, many issues in the last few weeks. As late as last week, we had I organised a complete briefing for all of the Labor MPs, along with every other MP in New South Wales. Politicisation is not a great thing to do when you're at war. And I have to say I'm very, very, very disappointed. Her call is about as silly as me saying she should stand down, and I'm not going to do that. I just think she needs to rethink her whole position on how she's dealing with these issues, and other than that I'm not going to comment on her statements.
If we do have a shortage of tests, could we be potentially missing the extent of community transmission now?
That is one of the issues that the medical people, our public health doctors, are concerned about. But having said that, New South Wales has done far more testing than any other state or territory. So I think in New South Wales, subject to the amount of equipment that we have, New South Wales has struck the right balance. Yep. And I think that's probably evidenced in the very positive numbers that we're now seeing. But you know what? I'm looking forward to the day. As I said yesterday, I'm scared about what's coming. I'm scared about what's happening now. And I think we're all scared for not only ourselves, but our families and our friends and our community. I think we've got to put our trust in the public health doctors and our frontline medical staff who are trying to look after us, and they're doing their best. So it's not time for casting blame. It's a time for making sure we work with them and just thank them for everything they're doing.